Wellness programs, okay, here's just some data and statistics is why there's a need for it. I mean, this is one of the biggest boons in the last 8 or 10 years that I've seen that I never expected when I started the consulting business. Employers used to say, I'm not going to put in wellness because they're not staying around long enough to benefit me. They're going to benefit somebody else. Why would I spend all this money to benefit somebody else when the employee leaves? That used to be the argument. It's a pretty strong argument. But the reality is employers have been doing it, and now everybody sort of benefits, and it's one of those community things where everybody is doing it, so you'll get the benefit of somebody else starting those programs, hopefully, if you're an employer. This is a chart I was asked as an actuary to explain to one of my major clients sort of what does all this mean pictorially. Some people can read words and understand the words that are written down. Some people need pictures. Some people respond more to verbal descriptions. So this client wanted a verbal picture, an actual picture of what our actuarial models were considering in our pricing. And so we said, okay, let's look at various categories of risk, from low risk to high risk. And it's always amazing how many people have no claims in a year. It's always between 15 and 20%. I told that to an insurance company one time. They didn't believe me. They went back and looked at the data, and they came back as 20%. People have no claims. No, that doesn't mean that they don't ever generate. Sometimes people put them in a shoebox and never send them in. There's just too much trouble, or they don't meet a deductible. But there's no claims, 15%, and the numbers behind it aren't all that important. They're sort of general, pretty close to national averages. But here's the idea of a wellness program. And I use wellness for the healthy part of the spectrum. Some people use wellness to be both the health management and the condition management, and they use the term wellness. There's no standards in this industry, so you've got to be careful when you're talking stuff. You understand the language of whoever you're speaking with. I use that as sort of the people who are typically healthy, and then I use the disease management or condition management for the chronic cases. But here's on the wellness programs we're focusing on here. What you want to do is people are going to have acute conditions. Most people are generally healthy. But you want to have programs in with prevention and wellness lifestyle important. So what you're doing is minimizing the number of acute conditions, a broken arm because they don't have the lifestyle of safety issues when they're climbing mountains or flying airplanes, whatever. But whatever it is, then you want to maximize the recovery, get them back here as fast. So the early intervention and the wellness clinical. So this is where the wellness programs, why there's savings in there, because you're minimizing the acute conditions and you're maximizing the recovery back if they do have that. On the chronically ill, it's a similar thing. You can have people that are very chronically ill, and by definition, chronic and persistent is chronic and persistent. They're not going to get any better, in all likelihood. I know the mental health community I work with and many others talk about recovery. Nice term, but alcoholic is always an alcoholic if you go to AA, right? If you're diabetic, you're probably going to always be diabetic. There's not many people recover from that totally and completely, so you got to be careful your whole life. So if you're chronic and persistent, what you want to do is you're a whole lot different costs if you're stabilized, chronic and persistent condition, than if you're not stabilized. Well, that involves lifestyle changes. Again, you don't always get that from a physician directly, so there's lifestyle information needs to be in your programs. But you minimize the complications, you maximize the stabilization, and a stable diabetic is going to cost you a whole lot less than one that's not stable and has to have their foot amputated or go blind or all sorts of complications. Here's all sorts of programs that are out there employers can choose from. I mean, if you don't have strategy, you don't have a vision, you don't have your whole outlook, these are vendors who will sell all these services to you, and if you don't have them coordinated under a common vision, you'll be spending a lot of money. They're good programs, but again, you need to have them coordinated within your overall strategy. This is an interesting chart, show how the diagnostic quest, 60% of employees who participate in wellness programs report that the incentive is a deciding factor in their choice to participate. Incentive has been so successful in increasing participation that approximately 2/3 of the employers who invest in employee wellness use an incentive to drive employee participation. Then you can see the biometrics that have become so common as the last item. Not everybody is down to biometrics yet. If you're putting a program in, it's pretty difficult to jump to that level. Most, again, are introducing programs with participation incentives or rewards, and then over the next couple of years, they'll work their way into biometrics. And typically, even the biometrics, companies that want to implement that say, okay, I'm not going to give you any penalty or reward for the first year. We're just going to give you your measurements until you get your act together. And starting next year, after this first trial year, there's going to be some penalties or incentives to go along with programs. So you kind of give people fair warning and a chance to gear up. So don't expect just jumping into something like this because you'll scare the heck out of your employees. It's that comment that was made earlier. Don't make too many changes all at once and upset them because they'll be skeptical and just think you're trying to mess with them anyway and cost shift to them. The wellness, prevention, early intervention, also called what? Health management. All right. Again, you can see the different generations, how it works. Real important over here is this work site. We're seeing a lot in the States that is not on this chart, maybe on some of the others, and that's clinics, on-site clinics. Big growth in on-site clinics around, especially our part of the country. I don't know about other parts of the country. Is that happening? Cerner. Okay. Other parts of the country seeing out west? A lot of on-site clinics? And we're seeing more and more issues around big companies started doing it. Now companies in a geographic area are going together. And I think the big movement that we're going to see there is around telemedicine. So that you almost have virtual on-site clinics. I see that growing a lot. In fact, I'm working with some doctors now that want to bring the home visits back with telemedicine.